Cameron and Janice here from Magnetic Experience. Today we're going to talk about magnetic therapy and arthritis knee pain. Now, the whole idea of magnetic therapy is that by placing a magnet on an area, it will help to or assist to increase blood flow, which may assist to reduce inflammation and pain in that localised area. Now, that area could be in pain for multiples of reasons, but today we're just going to talk about arthritis knee pain. Which means there's rheumatoid or osteoarthritis. Now, rheumatoid, of course, is a inflammatory condition, and osteo just means that your poor old joints wearing out. So, if you've got those problems, we can't fix the disc, but we can help to assist in reducing the inflammation around that area, which will give you more movement and reduce pain. Excellent. And that's what it's all about. Okay, so we have a multitude of different products to put wherever we've got on the body, because they all do the same job. They're just different vehicles for holding the magnet against the skin. But today, when we're talking about knee problems, we talk about the magnetic knee support, and we'll talk about the magnetic body stud. So Janice, you can start with the knee support if you like.
Well, I do find the knee support very, very good for me because, well, one, it's very, very comfortable to wear. As you can see, it's stretch cotton, so it's easy to wear. It's not big, it's not bulky, it's not hot. You can wear it summer or winter, night or day, whereas I find a lot of supports and knee guards on the market are all made with neoprene these days, which is big and bulky and hot and sweaty. So that's why I think ours is so good for that reason. And as I mentioned to you, it is comfortable enough to wear day or night. I actually just wear, I've got arthritis in my knee joint now, and I just find if I wear it to bed at night, I'll just show you this one. If I wear it to bed at night, I don't need to wear it during the day. I get the results from just wearing it at night. And that way I don't need to wear a guard throughout the day, which is wonderful. But it's very comfortable to wear to bed and to sleep in, which is great. Inside, I'll just show you the inside of it so you can see the construction is all the way round. You've got the 1000 Gauss 32 north-facing ferrite magnets. So it's a very, very strong support as far as the actual content of the construction of the magnets. It's very, very strong and very, very comfortable to wear. But I find that does the trick for me, and I just wear mine to bed at night.
Now, back to the 32 magnets, there's four strips of 8 which surround the support, and we've done it that way. So what it will do is engorge that area with magnetic therapy to assist with inflammation and pain of their arthritic condition. So Janice wears, she's a professional athlete, so of course she's suffering now as a result of that, but different people have different responses. Now, Janice likes to wear hers of a night time, and it gives her relief of a daytime. Now, my advice is put the guard on until the pain goes away. As simple as that. So some people might get very quick results and then take it off. Some people, their pain is so chronic they wear it 24/7. Where other people might say, well, I wear it for a day or two and then I take it off until the pain goes away and then I stick it back on. So it all varies from person to person, but what I can assure you is that we get very good results all the time. So that's a magnetic knee support. Now, the other very clever little product is if you don't want to wear a support, or sometimes you get them to working with each other, if you don't wear that and you just want to put these on, these are powerful little 3000 Gauss magnets. And they're the rare earth magnets, and you just place them on the knee problem area with the aid of a little band-aid. The band-aid holds the magnet against the skin. So peel it off, stick it on, shower and all in them. When the band-aid gets yucky, you keep the magnet and use it over and over and over and over again. So they don't run out.
You just replace the magnet onto a new band-aid, that's all, okay? But the reason these are so good is, one, two, it's great if some people don't need the support as well as the magnetic therapy, so that's where the body studs do come in. If you don't need the support, you only need the magnetic therapy, well, then the body studs are for you. But also, too, I find people, when they use the body studs, they get almost an immediate response from the magnets because the magnet is being placed directly onto the skin. There's not layers and layers of material or things in between. It's direct therapy onto the skin. So people ring me and say to me, I just put them on half an hour ago and I've already got pain relievers. They're supposed to work that fast. They're actually in a little bit of shock that they receive such good response, almost immediate, with the body studs. So they are a very powerful magnet to start with. They are a 3000 Gauss neos. They have a very deep flux into the body, but as I said, it's directly being placed on the skin. So it's even more effective.
Now, a clever little trick, I professionally speak at hundreds, 500 odd groups on magnetic therapy, and a clever trick I do is before I start talking, I place these little rare earth magnets on people in the crowd. I say, who's in pain, especially hands, fingers and joints like that. I put 2 or 3 little magnets on their thumb, for example, and most people at the groups do have chronic hand problems. And over the course of the 40 minutes I watch who I've put them on, and I can see them moving their fingers, and I know they're thinking to themselves, that damn thing's starting to loosen up already. So we get very good response with these. So, you know, that's one choice. That's another choice. Another good thing about the body stuff, because there's a pack of 12, you're not limited to sticking it on your knee. You can stick that anywhere on your body to trial. It's a good little trial track to see how magnetic therapy works for you. Now, Janice and I have a wealth of experience to share on magnetic therapy. As you can see, there are numerous other videos which I invite you to have a look at. Some are product focused and other are ailment focused, so have a look. Now, from that video you should see that we know what we're talking about. So what I suggest is you can either email us, and I can type you back a novel, but even easier, just give us a call. We're a husband and wife team.
That's right.
We work from home, so ring us anytime you like. Not too late, not too early, but just give us a call and we'd love to talk to you about your knee problems. Give us a call.